Ghaith Prometric Exam Question and Answers, Part 6.
Vaccination General Knowledge. At birth, BCG, hepatitis B. In 2 months, IPV or inactivated polio vaccine, DTaP for diphtheria, tetanus, and whooping cough, hepatitis B, HIV or Haemophilus influenza vaccine, pneumococcal conjugate or PCV, rotavirus vaccine. For 4 months, IPV or inactivated polio vaccine, DTaP, hepatitis B, HIV or Haemophilus influenza vaccine, pneumococcal conjugate, and rotavirus. In 6 months, OPV or oral polio vaccine, IPV or inactivated polio vaccine, DTaP for diphtheria, tetanus, whooping cough, hepatitis B, HIV or Haemophilus influenza vaccine, pneumococcal conjugate, and rotavirus. In 9 months, measles, meningococcal conjugate quadrivalent or MCV4. In 12 months, OPV, MMR or measles, mumps, rubella, pneumococcal conjugate PCV, meningococcal conjugate quadrivalent or MCV4. In 18 months, OPV, DTaP, HIV or Haemophilus influenza, MMR, varicella, hepatitis A. In 24 months, hepatitis A. First class primary school age, OPV, DTaP, MMR, varicella. How to store vaccines in ice. Measles vaccines administered route: A. Intramuscular, B. Subcutaneous, C. Intradermal, D. Intravenous. The answer is B. Subcutaneous. For DTaP or for diphtheria, tetanus, and whooping cough vaccine administered route: A. Intramuscular, B. Subcutaneous, C. Intradermal, D. Intravenous. The answer is A. Intramuscular. A 6-month-old boy with hydrocephalus is admitted to the pediatric surgical ward for ventriculoperitoneal shunt insertion. Which of the following findings would be at the most concern when assessing the child's post-operative? A. Sunken fontanelle and irritability, B. Decreased head circumference, C. Poor feeding and pupillary change, D. Headache and excessive sleepiness. The answer is C. Poor feeding and pupillary change. Patients with shunts are evaluated for evidence of signs or symptoms related to complications or malfunctions. Acute symptoms of malfunctions are headache, lethargy, diplopia, nausea and vomiting, seizure, irritability, poor feeding, head enlargement when sutures are open, tense fontanelle, fever, and neck rigidity. The nurse are reviewing the immunized schedule of the 11-month-old baby. Which of the disease should be the nurse expect the infant that are immunized against? A. Pertussis, tetanus, polio, and varicella. B. Polio, pertussis, tetanus, and diphtheria. C. Varicella, polio, tuberculosis, and pertussis. D. Measles, mumps, rubella, and tuberculosis. The answer is B. Polio, pertussis, tetanus, and diphtheria. General knowledge. Dexamethasone. It accelerates maturation of fetal lung. Hirschsprung's disease. Failure of neonate to pass stool. Meconium for 24 hours. Apgar score is done at 1 minute and 5 minutes at birth. Most common cause of diarrhea in pediatric. Virus, rotavirus. Meconium is, the color is dark green stool in newborn. Less than 24 hours after postpartum, the mother calls a nurse in the mother-infant unit. She is newly discharged and she reports that she has very heavy, bright red bleeding. What would be the best advice to give her? A. Don't worry about it, it is normal. B. Call your doctor and ask what to do. C. Lie down, massage lower abdomen. If it does not work, then come to the hospital immediately. D. Lie down for about an hour, then check your bleeding. If it is still as heavy, call me back. The answer is C. Lie down, Massage lower abdomen. If it does not work, then come to the hospital immediately. 5 minutes post-birth, a neonate has a heart rate of 98, irregular breathing, active moves all extremities, but has bluish hands and feet, with a weak and timid cry. Which is the correct APGAR assessment score? A. 9, B. 8, C. 7, D. 6. The answer is 6. A nurse documented assessment on a newborn as listed below. Points indicator of the heart rate is 98 beats per minute. Respiratory rate is irregular, which is 28 beats per minute. The muscle tone is a minimal flexion of the extremities. Reflex irritability. The grimace. Body pink. Extremities blue color. What is the total APGAR score? A. 0. B. 3. C. 5. The answer is 5. Pediatrics questions. Toddler is admitted to the pediatric room with several episodes of diarrhea for 3 days. The child is diagnosed with gastroenteritis. Which organism is responsible about the most diarrhea episodes in children? A. Rota. B. Bacillus magisterium. C. Shigella. D. Staphylococcus. The answer is A. Rotavirus. A rotavirus is a very contagious virus that causes diarrhea. Before the development of a vaccine, most children have been infected with the virus at least once by age 5. Although rotavirus infections are unpleasant, you can usually treat this infection at home with extra fluids to prevent dehydration. A child with a diagnosis of tetralogy of Fallot is scheduled to be discharged from the hospital. The nurse who is planning discharge education should instruct the caregivers that during a hypercyanotic spell, which position is most likely to be benefit for the child? A. Supine. B. Prone. C. Side lying. D. Knee chest. The answer is D. Knee chest. The best position for tetralogy of Fallot for comfort, your doctor may suggest that you bring the child's knees up tight against his or her chest. This is called the knee chest position, or have your child squat down. This will increase blood flow to the lungs. A 12-year-old boy was brought to the emergency with respiratory arrest due to drowning. Cardiac resuscitation was done. What is the major complications that might happen if treated after drowning quickly? A. Sepsis. B. Alkalosis. C. Acidosis. D. Hyperthermia. The answer is C. Acidosis. Which of the following is the leading cause of injury for children who are more than 5 years old? A. Accidental suffocation. B. Motor vehicle. C. Congenital anomalies. D. Drowning. The answer is B. Motor vehicle. A 1-year-old girl admitted to pediatric medical unit with significant weight loss, diminished mid-arm circumference, diarrhea, and red hair. Which of the following types of malnutrition do the nurse suspect? A. Marasmus. B. Spitting up. C. Kwashiorkor. D. Rickets. The answer is A. Marasmus. The main difference between the marasmus and kwashiorkor, the kwashiorkor is predominantly a protein deficiency, while marasmus is a deficiency of all macronutrients like protein, carbohydrates, and fats. The symptoms of marasmus: weight loss, dehydration, stomach shrinkage, and diarrhea, while the kwashiorkor symptoms: an inability to grow or weight gain, edema or swelling of the hands and feet, and stomach bulging. A 33-month-old infant is admitted to the emergency department with fractured arm. The mother indicated that while the child was crawling, she fell down the stairs and broke his arm. Which of the following observation would lead the nurse to suspect that this is the victim of abuse? A. Age inappropriate injury. B. Pattern and shape of the injury. C. Child is appearing malnourished. D. Improper explanation of the cause of injury. The answer is D. Improper explanation of the cause of injury. A 5-year-old child was brought to the emergency room with fractured right forearm. He had several bruises on his body but showed no signs of pain while palpating them. He seemed scared and did not answer any questions asked. Why should the nurse discuss this case with the nurse manager? A. Continuity of care. B. Rule out child abuse. C. Psychological support. D. Fractured management. The answer is B. Rule out child abuse. A 4-year-old child is seen in the emergency department with spinal fracture of the left arm. The X-ray exam showed previous broken healed bones. What is your immediate action? A. Call social services to immediately arrange foster care of the child. B. Ask the child about the previous accidents and management. C. Report the child abuse to the local authorities. D. Try to establish rapport and trust with the child's family. The answer is C. Report the child abuse to the local authorities. A child with a ventriculoperitoneal shunt or VP shunt is discharged and is anticipated after 2 days. The nurse is teaching the parents about signs of shunt malfunction. Which of the following signs indicates shunt malfunction? A. Depressed fontanelle. B. Vomiting and lethargy. C. Increased heart rate. D. Hematuria. The answer is B. Vomiting and lethargy. A 3-year-old child is seen to the emergency department experiencing a seizure at home. There is no previous of seizure. The mother informed that she does not believe the child has epilepsy. Which of the following is the best response? A. No need to worry because epilepsy is easily treated. B. Very few child have actual epilepsy. C. The seizure may or may not epilepsy. D. Your child has had only one seizure. The answer is C. The seizure may or may not epilepsy. A 16-year-old girl was found unconscious in her home by her mother. She was brought to the hospital by ambulance. The patient has no previous known medical history. On arrival, the nurse performs an assessment for level of consciousness and notes Glasgow Coma Scale of 5. The nurse notes the patient's breath smells like acetone or fingernail paint remover. What is the priority therapeutic goal? A. Increase blood glucose. B. Increase serum osmolarity. C. Increase circulatory volume. D. Decrease intracranial pressure. The answer is C. Increase circulatory volume. If a person's breath smells very fruity or strongly of acetone, it can indicate diabetic ketoacidosis. The symptoms of ketoacidosis is passing urine more than usual, nausea and vomiting, abdominal pain, high blood sugar levels, breathing difficulties, confusion, dry or flushed skin. In patients with diabetic ketoacidosis, the fluid deficit could be up to 10 to 15% of the body weight. Immediate fluid resuscitation is vital to correct hypovolemia, to restore tissue perfusion, and to clear ketones. Hydration improves glycemic control independent of insulin. A patient has a defect with the beta cells of the islets of Langerhans. Which of the following should the nurse most likely expect this patient to exhibit? A. Anemia. B. Appendicitis. C. Cholelithiasis. D. Hyperglycemia. The answer is D. Hyperglycemia. The most important cells are the pancreatic B cells in the islets of Langerhans that comprise around 45 to 50% of human islets and 75 to 80% in the mouse. Pancreatic B cells secrete insulin at high glucose concentration, thereby finally regulating glycemia by the hypoglycemic effects of this hormone. Since the beta cells is defective, so there's no enough secretions of insulin from the beta cells and leads to high concentrations of glucose in the blood. The nurse is planning care for several children who were admitted during the shift. Daily weights should be the plan of care for the child who is receiving A. Total parenteral nutrition or TPN. B. Supplemental oxygen. C. Intravenous anti-ineffective. D. Chest physiotherapy. The answer is A. Total parenteral nutrition or TPN. A nurse has just started total parenteral TPN as prescribed for a patient with severe dysphagia with low prealbumin levels. In 1 to 2 hours, the nurse should anticipate assessing the patient's A. blood glucose level, B. weight, C. liver, D. SpO2. The answer is A. blood glucose level. A 28-year-old male is recovering from a moderate concussion following a motor vehicular accident 2 weeks ago. When he suddenly develops an increased thirst, craving cold water, the patient urinates very large amounts of dilute water, like urine, and specific gravity of 1.001 to 1.005. The patient is most likely developing A. diabetic mellitus, B. diabetic insipidus, C. hypothyroidism. The answer is B. diabetic insipidus. Diet questions. While planning for discharge education for a mother or rickets, the nurse knows to include the need for an adequate food supplement. Which food should the mother choose for her child? A. potato and squash, B. orange and tomatoes, C. egg yolk and fish, D. milk and yogurt. The answer is C. egg yolk and fish. Rickets is the softening and weakening of bones in children, usually because of extreme and prolonged vitamin D deficiency. Including foods with vitamin D in your child's diet may help prevent rickets. Food with vitamin D include fresh fatty fish, example, salmon, herring, mackerel, and sardines, liver, and some mushrooms and egg yolks. Some foods have vitamin D added, such as margarine and some breakfast cereals or dairy products. A 50-year-old woman with inflammatory bowel disease is scheduled to undergo a procedure in which a stoma will be formed in the right lower quadrant, 5 centimeters below the waistline. The nurse advises the patient on how to avoid potential post-operative intestinal obstruction. Which of the following types of food best recommended for post-operative? A. broccoli and fish, B. meats and cauliflower, C. yogurt and parsley, D. corn and seeds. The answer is C. yogurt and parsley. What to eat to avoid bowel obstruction? Clear fluid only, all thin liquids, soft or pureed foods only, low fiber, and soft sloppy foods and low fiber. A nurse is providing education to a patient who is being discharged after cholecystectomy and has been placed on a low-fat diet. Which of the following foods should be avoided by the patient? A. canned beans, B. whole milk, C. rice, D. fish. The answer is B. whole milk. The nurse is caring for a patient who have abdominal pain, constipation last 3 days. The nurse teaches the patient about the most likely active producing foods. What are the foods that are mostly useful to relieve constipation? A. cheese, pasta, and eggs. B. rice, eggs, and lean meat. C. bran oats, figs, and prune. D. cabbage, bananas, and apple. The answer is C. bran oats, figs, and prune. Discharge teaching for a child with celiac disease would include instruction about avoiding which of the following? A. rice, B. milk, C. wheat, D. chicken. Answer is C. wheat. A nurse is caring for a patient diagnosed with abdominal X-ray reveals evidence of pancreatic sign of biliary disease. What would the nurse most likely instruct the patient? A. consume a high-protein diet. B. gradually increase dietary fiber. C. avoid ingestion of alcoholic beverages. D. limit activities when the patient is fatigued. Answer is C. avoid ingestion of alcoholic beverages. A 6-year-old male is diagnosed with nephrotic syndrome. When nursing care for the patient, the plan of diet should be A. high salt, high fat. B. high salt, high cholesterol. C. low salt, low fat. D. low protein and high fat. The answer is C. low salt, low fat. A 5-year-old child was admitted with nephrotic syndrome. A nurse noticed that the child was slightly facial puffiness with mild pitting edema on his hands and feet. There was no distended abdomen. Which type of diet the nurse should order for the child? A. High protein, high salt diet. B. Low protein, low fiber diet. C. Low protein, normal salt diet. D. Normal protein, low salt diet. The answer is D. Normal protein, low salt diet. An Indian patient who is vegetarian is being discharged from after an elective surgical procedure. The unit nurse is teaching using visual aids and pictures about food combination, complete proteins. Which of the following food items should the nurse recommend the dietary list for the patient? A. Lentils. B. Potatoes. C. Macaroni. D. Green salad. The answer is A. Lentils. An adolescent with juvenile diabetes mellitus developed chronic renal failure. Which of the following diets is suitable? A. Low fat. B. Low mineral. C. Low protein. D. Low carbohydrates. The answer is C. Low protein. A 60-year-old patient was admitted with hepatic coma in the intensive care unit. The physician has ordered protein restriction diet for the patient. Which of the following substances is most likely causes harmful effects when the patient increases protein intake? A. Urea. B. Creatinine. C. Ammonia. D. Amino acid. The answer is C. Ammonia. When protein intake is high, the liver may not be able to efficiently convert all the ammonia to urea, leading to an accumulation of ammonia in the bloodstream. A 68-year-old patient admitted to the emergency room with clinical manifestations of pulmonary embolism. Arterial blood gas or ABG and chest x-ray were ordered. Which of the following tests is used to diagnose this condition? A. Computed tomography scan or CT scan. B. Magnetic resonance imaging or MRI. C. Pulmonary angiography. D. Pulmonary function test. The answer is C. Pulmonary angiography. Pulmonary angiography is done. It is most often used to detect blood clots or pulmonary embolism and other blockages in the blood flow in the lungs. Most of the time, your provider will have tried other tests to diagnose a blood clots in the lungs, but pulmonary angiography may also be used to help diagnose AV malformations of the lungs. A 23-year-old woman presents to the clinic with an intense headache that rates at a level of 8 on 1 to 10 scale. Additionally, she feels nauseous, sensitive when exposed to bright light. Cerebrospinal fluid samples were sent to the laboratory for analysis and complete blood count. Testing both Kernig's and Brzezinski sign are positive. The patient is admitted to the hospital and 1 hour later she has a seizure. In the period was immediately following the seizure, the nurse stays at the bedside to provide ongoing care. Which of the following assessment has priority at this time? A. Blood pressure. B. Respiratory drive. C. Pupillary changes. D. Level of consciousness. The answer is B. Respiratory drive. In this case, there is a high likelihood for meningitis because of the presence of Kernig's and Brzezinski sign. What is a positive Kernig sign? The Kernig sign positive result is the elicitation of pain or resistance with passive extension of the patient's knees past 135 degrees in the setting of meningeal irritation. Brzezinski neck sign raises suspicion of meningitis. It can be elicited by flexing the individual's neck while lying flat on their back. If passive flexion of the neck results in the reflex flexion of the hips and knees, it is a positive sign of meningitis. A 3-year-old child with an elevated body temperature is administered oral aspirin. The nurse records the body temperature of the child 2 hours and finds that it is still elevated. What is the most likely underlying physiology for the delayed response in action of the aspirin? A. High gastric pH. B. Thin epidermis. C. Low muscle tone. D. Short intestines. The answer is A. High gastric pH. A 65-year-old man is undergoing a preoperative preparation for endoscopy procedure in which the physician will visualize the large and distal part of the small bowel with a camera telescoping attached to the flexible tube. Which of the following position is the most appropriate? A. Left lateral Sims position. B. Right lateral recumbent position. C. Trendelenburg position. D. Prone position. The answer is A. Left lateral Sims position. Why is an endoscopy done in the left lateral position? Compared with the prone position, the left lateral position is more comfortable for the patients, particularly in cases with limited cervical movement, including cases of cervical cord injury and cervical spine operations. A 60-year-old man is being discharged from the post-operative care unit following a transurethral resection of the prostate. The nurse provides discharge information regarding the care of the bladder catheter. Which methods would be the most effective in bladder retaining for this patient? A. Scheduled urination every 2 to 3 hours. B. Limit fluid intake before sleeping time. C. Perform pelvic floor exercises daily. D. Increase fluid intake during the daytime. The answer is A. Scheduled urination every 2 to 3 hours. With the catheter method, for retraining the patient's catheter, the catheter is clamped for 1 hour to prevent the bladder from draining. This forces the bladder to expand. After 1 hour, the clamp is released and the bladder is allowed to drain. The catheter clamping time is built up to 3 to 4 hours at a time, and this may be done for 24 to 72 hours. The unit nurse conducts initial assessment and observes the dressing is wet and requires change. The patient looks drowsy with warm skin. The laboratory results shows blood pressure is 110/70, respiratory rate is 24, heart rate is 99, temperature is 38.8. The test results with the normal values. The RBC result is 5.5 and the normal values is 4.7 to 6.1. For the hemoglobin, the result is 133. The normal values is 130 to 170. For WBC, the result is 25.5 and the normal is 4.5 to 10.5. What is the most likely underlying diagnosis? A. Sepsis. B. Gangrenous tissue. C. Acid-base imbalance. D. Hyperthermia secondary to infection. The answer is A. Sepsis. A nurse is completing the preoperative checklist of one patient with a ring. What is the most appropriate action? A. Give ring to security office. B. Lock ring with patient's valuables. C. Call patient's family to give them the ring. D. Respect patient's choice and leave the ring on patient's finger. The answer is B. Lock ring with patient's valuables. A 17-year-old woman went to the emergency department complaining of fever, sore throat, and hoarseness of voice. Laboratory tests were done. The results are hemoglobin 120.5, the normal is 120 to 158. Hematocrit is 0.39, the normal is 0.36 to 0.47. The RBC is 4.0, the normal is 3.8 to 5.0. WBC is 14.2, the normal is 4 to 10.5. The throat culture results positive beta hemolytic Streptococcus. Which of the following would be the possible complications of the patient's condition? A. Cellulitis. B. Bacterial cholangitis. C. Infected endocarditis. D. Rheumatic heart disease. The answer is D. Rheumatic heart disease. A post-operative patient has an order to discontinue the Foley catheter at 11:30 a.m. The nurse removes the Foley catheter at 1 p.m. The patient complains of feeling the need to urinate and voids 30 cc. The nurse should assess the patient for signs which of the following? A. Urinary retention. B. Urinary tract infection. C. Cystitis. D. Hematuria. The result is A. Urinary retention. An ICU nurse reviewed the charts of our 47-year-old man patient in mechanical ventilator for a long time. Arterial blood gas results are: the ABG Bicarbonate is 24. The normal values is 22 to 28. PCO2 or carbon dioxide is 10.66. The normal is 4.7 to 6. The pH is 7.16. The normal is 7.35 to 7.45. The PO2 is 6.13. The normal is 10.6 to 14.2. The auto saturation is 81 and the normal is 95 to 100%. What condition the patient is experiencing presently? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The answer is C. Respiratory acidosis. To decrease the anxiety of a 10-year-old girl who is undergoing surgery, which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is A. Use a heart model to show her how the surgery will go. The patient who is admitted denies any medication allergies in medical records and state no known drug allergies. A medicine order request sent to the pharmacy for gentamicin. The pharmacist's record in the pharmacy states with allergy to the medication. Which of the following is the best way for the nurse to do? A. Administer the medication with Benadryl. B. Notify the doctors of the allergy and request new orders. C. Investigate further, then call the doctors for clarification. D. Give the medication as ordered by the physician. The answer is B. Notify the doctor of the allergy and request new orders. An 81-year-old bedridden patient in the geriatric ward was on antipyretic through his nasogastric tube. After an hour, the patient was on deep sleep. His breathing pattern changed and he did not respond when calling his name. Which of the following should be the immediate nursing action? A. Call the physician to examine the patient. B. Check for the correct dosage given. C. Check vital signs and inform the physician. D. Try to wake up the patient. The answer is C. Check vital signs and inform the physician. At the beginning of the afternoon shift in the receiving handover from a morning shift nurse in post-coronary angioplasty, the nurse noticed absence of waveform on the monitor. Upon assessment, the carotid pulse is absent. What should the most appropriate next action? A. Give a DC shock. B. Refuse to receive the patient. C. Check ventilator settings. D. Shout for help and start chest compressions. The answer is D. Shout for help and start chest compressions. After activating the emergency call system, what should be the next immediate action? A. Initiate ventricular pacing. B. Administer a bolus of lidocaine as prescribed. C. Defibrillate the patient. D. Open the patient's airway. The answer is C. Defibrillate the patient. A nurse is caring for a 58-year-old patient. The test is magnesium. The result is 2.8. The normal values is 0.7, 1.2 millimole. Which ECG change is the nurse expect to note? A. Prolonged QRS. B. Multiple P waves. C. Prominent U waves. D. Depressed ST segment. The answer is A. Prolonged QRS. The most noticeable ECG changes for hypermagnesemia are PR interval prolongation, an increase in the QT interval, or an increase in QRS duration leading to heart block. During surgery that requiring general anesthesia and a carotid pulse is not palpated, how many compressions per minute should be? A. 50, B. 60, C. 80, D. 100. The answer is D. 100. Which of the following indication for patient with myocardial infarction? A. ST depression. B. ST elevation. C. Short ST. D. None of the above. The answer is B. ST elevation. 40-year-old man is admitted to a coronary pain. The ECG has normal sinus rhythm with leads V1 to V4. The blood pressure is 123/69. What is the most likely nursing diagnosis? A. Acute chest pain. B. Myocardial infarction. C. Decreased cardiac output. D. Ineffective tissue perfusion. The answer is A. Acute chest pain. Which of the following is most appropriate to delegate to nurse assistants? A. Insertion of an oral airway. B. Changing postoperative dressing. C. Initial interview on a newly admitted patient. D. Repositioning a patient to side-lying position. The answer is D. Repositioning a patient to side-lying position. Which of the following patients the nurse should see first? A. Patient complaining of muscle aches and fever. B. Patient scheduled for electrocardiography. C. Patient newly diagnosed with hypertension. D. Patient with complaint of chest pain. The answer is D. Patient with complaint of chest pain. A man was restless and observed to have an increased physical activity after a heated argument with another person. After the assessment, the following data was gathered. He is agitated, diaphoretic, distorted. What is the patient level of anxiety? A. Mild. B. Panic. C. Severe. D. Moderate. The answer is C. Severe. A 70-year-old man underwent a colectomy 2 days prior. In the past 24 hours, his blood pressure was decreased and heart rate is risen. He now weighed 2 kilograms more than he did prior to admission. Urine output from the indwelling catheter is 30 ml per hour, and he was pitting and plus bilaterally in the lower extremities. The abdomen appears distended and is firm to touch. The blood pressure is 112/62. Heart rate is 110. Respiratory rate is 20. Which of the following is the best nursing intervention? A. High flow oxygen by mask. B. Position in Trendelenburg. C. Hemoglobin and hematocrit. In the postoperative period of colectomy, there's an incidence of anemia. Increases to 77% and 66% respectively, mainly because of the intraoperative blood loss. A newly RN nurse is about to remove a nasogastric tube to a client with Guillain-Barré syndrome. To determine the proper time of removing the tube, the nurse should do it when A. When the client's feeling hungry. B. When the client wants to remove it. C. When the client's totally conscious. D. When the client exits flatulence or gases. The answer is D. When the clients exit flatulence or gases. A 28-year-old woman is accompanied by her mother to the ward. She is admitted for her affected disorder with anger, with the recent events and stammering spells. She has panic followed by apathy and restlessness. How should the nurse manage the patient? A. Be supportive and use therapeutic communication. B. Improvise sign language and control forgetfulness. C. Maintain calm environment and avoid argument. D. Anger management and speech therapy. The answer is C. Maintain calm environment and avoid argument. A nurse accidentally dropped a medication ampule and informed the charge nurse and completed an incident report form. The charge nurse arranges medications replacement. Which of the following is the immediate nursing action required? A. Revise protocol for medication-related incidences. B. Allocate senior nurses to medication assignments. C. Provide missed medication dosage to the patient first. D. Incident reporting must be done the priority. The answer is C. Provide missed medication dosage to patient first. A 42-year-old woman is brought to the emergency with severe chest pain and radiating to the left neck. The physician instructs the nurse to start the morphine sulfate, aspirin, or MONA protocol. What is the top priority of nursing care? A. Administer oxygen according to the physician. B. Administer aspirin according to the physician. C. Administer morphine according to the physician. D. Administer nitroglycerin according to the physician. The answer is C. Administer morphine according to the physician. Home health care department is newly established hospital. At launch, Nurses ask the charge nurse about work at this department. Which of the following is the first step of home health care? A. Referral. B. Planning. C. Home visit. D. Assessment. The answer is A. Referral. For home health care department, physician referral is the first step. From the hospital, patient is referred to home health care department and accepts referral. The home health care department manager, intake nurse receives referral and administrative info and assures patient eligibility for services. Intake nurses gather patient's information and identify the patient's priority acuity. Intake nurse or scheduler schedule first home health care visit. After the first visit, proceed to the assessment.